Good afternoon, everybody. Thanks for being here. Let's get to it. Unfortunately, we've lost two neighbors over the last 24 hours. A Asian female in her 70s, no underlying conditions, and a Caucasian male in his 60s with underlying conditions. Certainly want to think about the four people we've lost over the last 48 hours and their families, and keep them in our thoughts and prayers. We've received 3,592 tests back yesterday. 7-day rolling average, our positive rate is 2.6%. Our 14-day average is 2.1%. Looking at hospitalizations, we now have 49 individuals hospitalized. That's been steady for 3 days now. Part of that is because, unfortunately, we've had loss of life as well. So right now we have two neighbors of ours that are in the ICU. We have 30 out of the 49 individuals in the hospital. 32 are Caucasian, 5 are African American, 3 are Asian, 2 are of another race, and 7 individuals have yet to share their information with us. With cases, we now have 6,277 positive cases, 120 new cases. The 120 out of those, we have 14 higher ed cases, and 10 of the cases are related to K through 12. We have 11 cases that are travel related, Florida, Massachusetts, Virginia, other parts of New York State, making that up. 16 household contacts, 4 senior facilities, that's 2 staff and 2 residents. We're still tracing 16 cases right now related to this number, and we have 72 community spread, of which 42 are of a known source and 30 are an unknown source. We currently have 868 active cases, and we have had 5,197 people recover during the pandemic. When we look at the cases, who it's impacted, 3,474 female, 2,803 male, 817 under 19, 1,463 in their 20s, 851 in their 30s, 741 in their 40s, 879 in their 50s, 640 in their 60s, 389 in their 70s, 317 in their 80s, and 180 in their 90s. Going through our various testing protocols and programs right now, this is important. Today, as we've expanded testing, we need the public to work with us now and register. So for school testing, symptomatic testing, at the FSHAD, this is when there's a faculty member or a student is sick. For the saliva test, you need to register at mychart.upstate.edu, or you can call 315-464-2582. For your asymptomatic or symptomatic testing not related to school, you can use this lab as well, but we now need you to register because of demand. So it's ongov.net/Cayuga Medical. Again, ongov.net/Cayuga Medical. That's testing Monday through Friday from 9 to 1. We are doing asymptomatic saliva testing in the school buildings. In addition to that, right now, so that's going on today in the city of Syracuse, tomorrow West Hill, Thursday Liverpool, and Friday Fayetteville Manlius. This is voluntary testing. Again, so far we've only had one pool come back with a positive result. So that is something. And tomorrow we are doing asymptomatic rapid nasal testing here at the On Center. This is devoted this week to the hospitality industry. So this is appointments are filling up quickly. We need people to register for this. So if you work in the hospitality industry, an industry that's had lots of cases for COVID, this is rapid testing. Only if you're asymptomatic, though. If you're symptomatic, you got to go to another site. Please go to our website, covid19.ongov.net, and register. We're building up capacity. Tomorrow will be our first day doing this, so we'll probably be better at this on Wednesday and Thursday and be able to build up capacity. But we're going to use rapid testing to target industries in the community that are driving cases. Effective Wednesday, all bars and restaurants in the county will be closing no later than midnight. The yellow zones, after conversations with the governor's team, back and forth with health departments, my colleagues from Erie and Monroe came up with some guidelines and some guidance that everybody kind of basically agreed to, and then working with the governor's team on a data-driven approach to what parts of our community are in the yellow zone. We've come up with a map. I'll go over the map. What you see in front of you is the yellow map of the county. You see dots representing cases, and bigger dots represent more intense cases. Larger numbers. What does a yellow zone mean? Okay, so first off, in the county, for the immediate future, until the caseloads start to get in line, midnight is when bars and restaurants will close. In a yellow zone, what are some of the restrictions in a yellow zone? The restrictions are, if you're in a yellow zone and you have a restaurant, you are now maximum table is 4 people rather than 10. There's no restrictions on capacity of the restaurant, just maximum people per table. In a yellow zone, your gatherings are limited to 25 people, down from 50. If things don't start to get under control, we may do that countywide. In a yellow zone, another thing that must happen is for schools to remain in person, 20% of faculty, staff, and students must be tested on a weekly basis. This is a tremendous undertaking from your county government and your school districts. It's worth the work to keep our kids going to school. It's been a safe school year, but it will require cooperation. So I'm going to go through the affected municipalities and then the affected school districts. If your children are in the school district, we are going to need parents giving permission for their children to be tested. These will be rapid tests. They will be not a complete nasal swab that we had before. It will be a smaller nasal swab where essentially you'll be swabbing the inside of the nostril. So it's rapid, 15 minutes, not the intrusive swab before, but the only way we can hit these numbers is if parents are giving permission for their children to participate in the program. If they don't, and we don't hit 20% numbers and we don't have that, the districts will be forced to go to remote learning. So saying that, here are the municipalities: the city of Syracuse, the village of East Syracuse, the village of Solvay, the town of Clay, the town of Lysander, and the town of Salina. The affected school districts: the city of Syracuse School District, East Syracuse Manoa, Solvay, Lincorp, Baldwinsville, Liverpool, parts of North Syracuse that are in the 13090 zip code. So if North Syracuse has a building in 13090, but a building in 13039, it's only the 13090 building that needs to participate. Any private school and or charter school within these districts also needs to participate. So these are zip codes driving this. So you can see we will have a lot of testing going on. We'll work with our superintendents. It's not going to be feasible for in-person for some of this. We want to do as much in-person learning as possible and keep that going in the yellow zones. So we will work diligently to make that a reality with the superintendents. But in the event parents aren't going to let their children participate, you're making the decision for us. So that's what the yellow zone looks like. There's metrics for the yellow zone now. We'll be monitoring on a weekly basis the positivity rates within each of the municipalities. After a week, you take a hard look. If things are going in the right direction, things are getting better after 7 days worth of data, then that municipality has an opportunity to leave the yellow zone. In addition to this, today Syracuse University has decided to go to remote learning. Before at the university, when we had cases, they were targeted via clusters back to various events. We could trace them back. We could identify very easily who needed to be quarantined. Then you do all of your testing. They are experiencing more community spread right now. They're going to remote learning, I believe, for the rest of the semester. There will be, those cases are going to drive some of our data. Today we had a little bit of a bigger chunk of regular cases from SU, tomorrow as well, and we'll see what happens. But certainly those are more sustainable cases over the last week that normally we would see a slew of cases and then we wouldn't see many at all. So that's been one of the contributing factors to the numbers. The numbers look like they've stabilized. Tomorrow is going to be still a large caseload, but it looks like it's stabilized, not peaking. Now it's our job to starve the virus and move the numbers down. We need these numbers down by the end of the month, going into the winter months when there will be more pressure on us. So we'll continue to expand testing. We continue to do what we need to do, giving the health department the resources to trace. But again, if you have 100 cases a day, to expect them to be traced in a 8 or 10 hour business period is very difficult. And so we beef up the staffing. We continue to do this around the clock. But this is a gut check moment for the community. We got great news on the vaccine today, and there's light at the end of this tunnel. The challenge is we need to get from here to there in a way where we protect our communities vulnerable and keep our economy open. That means people need to be smart. The gatherings that have been happening, not just in our county, but in every county, need to be limited now as they go indoors. Certainly when we're sick, we need to get tested, stay home, and so that we can eliminate COVID, so that we can start to slow down the spread. And hopefully we don't move further into a yellow zone. There are communities on this map that are very close to being in a yellow zone. Manlius, you are very close to being in a yellow zone. Cicero, very close. What can we do? We'll increase testing in your community, but in addition to that, the gatherings, the neighborhood gatherings, there's pressure on these. Hopefully that slowed down this weekend because the weather was very nice and people were outdoors, saw each other outdoors. But you can see from the dots, this is the data. This is what it looks like. This is what the state sees when their epidemiologists talk to our epidemiologists, and they look at this and compare them to other areas of the state. So there's no denying the data. We are seeing different parts of the community that are not in the pause zone now, but are very close. So we got work to do there.
Would you run through the list again? I know I'm jumping the gun, but just to get it out quickly.
The list again for municipalities is the town of Lysander, and any municipality within the town of Lysander, the city of Syracuse, the town of Clay, the town of Salina, and then the village of Solvay and the village of East Syracuse. Questions?
So, walk through, if I live in the town of Lysander, leaving the school aside for a second, what does that mean to me that I'm in the yellow? How is that going to change my life?
If you have a party of 26 people at your house, Tim, you will be fined. And we know about it. Your gathering sizes are limited. If you go to a restaurant, instead of going with 3 or 4, 5 friends, you got to go with the most 4 people at a table. This is kind of, it's a yellow zone, right? Some people, when they're driving, they see the yellow light, they slow down, right? Caution, that's what we're supposed to do. Some people speed up. No more speeding up. We need to slow down a little bit. And if we do that, it should slow down some of the spread here.
But if I want to drive to a restaurant in Camillus, I can operate
Yep.
as normal.
Absolutely.
And as far as the schools, it sounds like an intensive obligation on the county now for testing.
It is a huge undertaking.
Does that, I mean, given what I think you've said in the past, that you're not seeing a spread of the virus in schools, does that use of resources make sense to you?
I think the program is what it is. We think that there's some ways you can probably tweak it to be a little bit more effective, and we've shared some of those thoughts. I think the state, when the state looks at how to handle this, they need some sort of uniformity. And so I think that's what we're seeing here. There was a lot of back and forth and give and take with what is in the zone. So I really appreciate that, that dialogue. We've been having that dialogue for over 48 hours now. We're going to do the things anyways that we think will help drive better outcomes. Schools have been the safest place for kids. When we look at our cases in schools, they're typically they're usually driven by adults who are more active socially than the children, or the kids are getting it from going to a travel sports game. They're getting it at home. They're getting it through a household contact. The spread has not happened in the buildings. We've looked at this. We've looked at this and looked at this. So when the cluster zones were done for some uniformity with the state, in the other counties where this started, they might have had that, or there might have been really good indicators that this would spread in the schools. Here, it doesn't fit as well, but we understand there's got to be uniformity across the state.
Have you calculated how many tests you'll have to do per week to hit that 20% overall number?
We're working at that. We're talking thousands, and so it's going to be a challenge. We'll meet the challenge to keep our kids learning, and we'll need cooperation from parents. If parents don't let their kids participate, we won't. The answer then, if the answer is no, then the schools will have to go remote until the data gets better, and so that's the challenge. So we really need great participation from the parents, from the faculty, the districts themselves, and we'll help manage this. We'll help get through this, get the supplies there. But this is what we call grinding it out, Tim. We got great news. Pfizer's got a great product that's very, very close to being ready. There's going to be a period of time in between when that gets out to our communities vulnerable, and we're going to need to grind this thing out.
Those will be done in school while kids are there?
Yeah, we're working through those logistics, but it's probably easiest for us to go to the students and to the faculty than try to have them transported.
And those, does that test cost about $100 per?
So some of these rapid tests that the federal government pushed through to the states, and the states are starting to push out, we'll use those rapid tests first to deal with this testing program. Once we run out of that, then then it will start being $100 per test.
This seems very direct reward if people participate. People need to do it if they want to keep their school district in person, correct?
Absolutely. If we don't have enough kids to meet this 20% number. There's only so many faculty and staff, right? I can't. I guess I can test the superintendent every day, right? So maybe I get 5 tests there out of the superintendent, but there's only so many other people. So for this to work, to be in person, we need participation.
In your conversations with the state, were you able to tweak anything like of plans that they did give you, or was it just cut and dry?
No. So the zone program is the state's program, and so where there's discussions about what we were seeing and what was a data-driven discussion, which again I'm very appreciative of. What is in the zone. This was about data. This is about looking at it. This is a dialogue. So there's a lot of discussion on the map. The and so with the recognition that if this is a moving target. This map could be here today. If we do everything very well for 2 weeks, we may be out of a yellow zone, right? If we don't do things well, we may go from a yellow to an orange here, and some of these other towns may go into a yellow zone. So this is a moving target, but I think it brings some clarity. I think this will hopefully let the community understand how serious this has gotten. We had someone die who doesn't have underlying medical conditions, okay? They died because they got COVID. That's always been some of the people who never bought into the pandemic have always said, well, the people dying are the only ones with underlying medical conditions. Yeah, a lot of them, but not today. So I think what we need to do is we need to just re-engage. We know what to do. We've been through this already. We now have the light at the end of the tunnel. We know it's there. We know things are going to get better. We got to dig in. And if we do that and everybody does the right thing, we can get our numbers down. We don't see peaks after Thanksgiving. Going into winter, we just got to get through it. And then hopefully we'll start seeing our communities vulnerable getting vaccinated. And then it will be the next subset of folks and the next subset. And in 2021, at some point, we won't talk about this anymore.
On the map, each color and size, it looks like represents a number of cases, but each dot is what? Is where? Is it a neighborhood, a street?
Yeah, so that would be where, it's a geocode map, so that's where somebody, one case would be a very small dot, but you may have a household that had 4 or 5. You may have a congregate setting that has more than that. So that's, the larger dots are more cases. You could have a street that has quite a few cases.
With, the holidays coming up, and you see these purple dots, those traveling other places, I mean, does that concern you at all, that, people could travel to another town who are in these zones? And
Yeah, so I'm not worried. The travel's the travel, right? These are, to Tim's point, if you want 10 people to go sit down at a table, you can go down to the Lafayette Inn, right? So you can go still do that. We're one of the nice things about Onondaga County, and get anywhere in 20 minutes. I think the reality is this needs to be a kind of a rallying call, just to kind of re-engage, and that the data doesn't lie, the hospital numbers don't lie, the wrong people are starting to get sick. It's very easy when you have young people who are your numbers and nobody's getting sick and going to the hospital. Now, because of the spread, and it's everywhere, the wrong people are getting sick again, and that leads to death. So we need everybody to just get engaged. For those of us who have children in schools, if we fall into one of these zones, we know the benefits of having our kids going back to school, seeing our kids with their friends and talking about their day. The value of that as parents means a lot. So as parents, we need to make sure that we're letting our kids participate in the testing program if we want to keep that. If we want to go on pause for 2 weeks in a district who can't do it, and hope that the data helps change itself in that community, and it's only 2 weeks, that's a position too. But the best way to get the data to change is to get lots of people tested.
In terms of the testing of schools, what will that look like? Will you, as soon as this week, start going to parking lots of schools, and it becomes kind of during the school day that kids come out and get tested? What are you thinking about?
We're still working on that, Andrew. This is fresh off the press. This is still warm, this board right here. That's how fresh it is right now. So we still got to work through those details with districts. Districts got to make decisions on what's feasible. Can they keep all their buildings open? Do they want to keep elementary open? They got decisions to make, and then we're going to need their staff to help implement some of this testing. Their nurses, can they work through that within their own bargaining units? There's a lot of details that need to be worked out.
Are you going to continue asymptomatic testing at the F shed, or was
Yeah.
it a one-day?
Nope, we're doing that. Today was the day. If you went, it was probably a little it didn't seem as organized. That's because we had over 100% capacity adding on, and there's a lot of people. So we need people to pre-register now just because of the demand. But we will continue to do that. In the event, as soon as we get our school testing done and we get the resources that we need from the state to implement this, we'll start to go into communities again and hopefully go to communities to address some of this. But again, we're activating more and more people that we now need in our overall response, even more than the beginning, I think. So a lot going on.
If you're a parent in one of the school districts you listed, what should they be preparing for tonight?
Yeah, I think so. It's not like tomorrow it's going to go remote, right? I think throughout the rest of the week, even if the decision's to go remote, I think the districts will probably make that decision next week. But I think we have, certainly there will probably be some communication out to parents. I'm sure there will be some sort of survey saying who will participate, so the districts know how many kids they have to see if it's feasible to meet that 20 number with staff and kids. And then if it's feasible, then it's game time. We figure out a way to get it done, and we get it done. If there isn't enough people willing to do the testing, then there's the answer. It's going remote.
I know enforcement's always tough, but are there any changes in terms of enforcement? Will there be an increase specifically for social gatherings?
We've been doing it, very rigorous enforcement over the last 2 weekends. We'll continue to do that. We're getting more and more. Enforcement is really, you do proactive enforcement based off where you see cases with businesses and based off of leads that are given to you from the community. I think we got a lead about a gala. Somebody who thinks they're going to have a gala right now in COVID. And so if that's you who thinks you're having the gala, we know about it. You're not having a gala. There's things that we hear about and we'll enforce based off of that. We don't, and again, this is painful for me to be talking right now about all this. I've been advocating all summer to have weddings and to have banquets and to get the hospitality industry there. The data doesn't merit us having that discussion anymore. It's gone the other way. So it is painful for me to be talking about enforcing these things that I was the strongest advocate for to open up more, 90 days ago.
Did the county have to fine anybody over this week?
Fines were given out, yeah. I think Saturday night, I don't know who, Tim, but I heard there's 3 or 4 fines given out to different establishments breaking the rules. I think Friday night, there was a good night. I think everybody pretty much was doing the right thing.
What Onondaga County has done and now has to do next seems remarkable. What's the alternative? Why put this much money and resources and energy into this testing, which seems to only be needing more work as the months go on? What's the alternative?
So what we have to do as a community is we have to find the virus. Even if that means we do 15,000 tests in a day and our cases go from 150 to 500, if we find the virus and we isolate the virus, that's how the comeback starts. And so we have to do that. And why do we do that for everybody who maybe wasn't hearing us at the end of the week? We've seen the direct correlation with active cases and hospitalizations. And now we've seen when the wrong people get the virus, what happens. And so it's all about preserving medical infrastructure and protecting our vulnerable. And the only way we can do that is if we know where it is. And now that it's in the community, it's not cluster driven. Summertime, we would have a little cluster here. Somebody came in, traveled, did this. Boom. Find it, wrap it, done. 4 cases the next day, 5 cases the next day. That's gone, right? We got to get this number. I think the number is stabilized. It's stabilized at a very bad place, but it seems like we've stabilized, knock on wood. Now we got to drive it down. And so we got to find it first, and then we need to isolate it to preserve our vulnerable and to preserve our medical infrastructure, because if you get into a car accident, you're going to want to go to the hospital. If your loved one's having a heart attack, you're going to want them to go to the hospital. And that's what it's about. And we can't let these cases in the next 90 days or 100 days until a vaccine gets distributed just get out of control, or else we won't be able to do all that.
Can you just go over over the metrics of getting out of the yellow zone one more time?
I believe the metrics have to do with a 7-day period of going below 2% in that geographic area. And so I'm not exactly sure. I haven't even looked that far yet, right? But I think it might be 2 or 2.5 in the county. But I think we're really talking about in these communities as well. So we're at 2.6 on a 7-day, 2.1 on a 14-day average. 2.6 is more reflective of where we are. So we need to get that number down. And so that's the reality. It's going to take a little bit of time to do that at the macro level. At the micro level, if you get some of these communities, right, you get 1,000 tests in Baldwinsville, a lot of tests in Baldwinsville. You do that for after a week, you look at your numbers might go really down. So these are the things that we got to do. That's the upside. We can make these yellow zones temporary if we all get a glove and get in the game.
What gets the community yellow? Are those zip codes? Are they town borders? What
Yeah,
exactly
you
are
look.
we
So it's
looking at?
positivity rates and based off of your population in some of these areas, and then it's just your common clusters too, Andrew. Right? So there's not if this map over the summer would have been pockets, right? You wouldn't see the complete spread like you do now, and so this is more challenging. That's why your macro level rules will probably impact it more, and so that's why countywide 12 o'clock bars and restaurants. That's until we get through this. That's what it's going to be.
Are those zip codes though? I'm just wondering what makes it.
Yeah, zip codes.
For the people who are listening and may take this lightly, what's your message to them, to everyone?
Well, we shouldn't take it lightly. 4 people have died over the last 2 days, right? 90 days ago, I was saying, Governor, open up weddings, open up conventions. Let's test. Let's figure out a way to say yes. I can't say that now. So when you look at where we are, the positive is there's a light at the end of the tunnel. We know what we need to do to get there, and then we're done with this thing, right? It's going to take some work and some time, though. So we really need people to adjust, modify your behavior, modify your gatherings. In the beginning of the pandemic, when you'd see your neighbors on the street, you'd be in your yard, they'd be in their yard, and you'd be looking, you're distancing better. You weren't having 15, 20 people inside. These are the things that, if we do these things, we'll take care of this. If we get sick, we get a test, and then isolate till we get the result. This will take care of itself. But we need to kind of get this thing down before we get into the wintertime, where there's going to be more pressure to be indoors. So we got a big 3-4 weeks ahead of us.
How long will the yellow designation last?
It's reviewed every week, but I think I think it's safe to say for the next 2 weeks, this is kind of where we are, and we got work to do in these other communities to stay out of yellow.
Are there any close to orange?
I don't think so. Not that we can see, but again, if we're talking 2 weeks from now and our county rate's at 3.6, not 2.6, I bet you see more yellow and you could see orange.
Do you worry about any bars and restaurants who just don't find it worthwhile to open at all if they can't be open past midnight, or if they can't seat a table with more than 4 people?
Yeah, I think at this point where we are with the pandemic, Andrew, the amount of people that are eating food after midnight, we just probably need to adjust our schedule, and maybe they need to do takeout between the hours of midnight and 2. I don't know if that's plausible, but again, I don't like being the bearer of bad news today. This is what's necessary. This is what my job is.
Can I ask you a quick off-topic?
Tim?
Well, just the hospital numbers seem to have kind of hit a plateau also around 4950. Are you hearing from the hospitals that they're any more concerned about their capacity and whether this will have an effect on
We're okay now, Tim. I mean, but let's just play this out a little bit, right? So today we had 72 people recover, right? Normally that might be our best recovery day during the pandemic. I don't know. But we still went up 45 because we had 120 new cases. So that's not sustainable, right? So our 800, let's see, where are we? Active cases, 868, 7% of that, 56. So we're performing slightly better than where we should be, but these people just got COVID. So 56 is where we normally are off of this, and we're at 49. So this number can't go to 1,600 or 2,000 or 2,500 without impacting our hospitals. And so that's what this is about. A, preserving those beds for other really serious situations. And B, we've seen what's happened. 66-year-old, underlying conditions. 78-year-old, no underlying conditions, lost their life. And so this virus is getting to people and getting them very sick. And so we got to re-engage.
Do you know the number in quarantine today?
Yeah. 2,041 people.
The school testing gets paid for by whom?
We will, not the schools. Right now, the federal government gave these rapid tests to the state government. They're now getting those out to us. We'll see how many they give us. If not, we then have to backstop that testing program. But we'll use those first. That will get us through the first week probably with what we got. I think we got 10,000 of them right now.
And those are the little white cartridge packets.
Correct.
You showed us weeks ago?
Correct.
And then 10,000 of those, then you go to your supply of regular diagnostic.
Yeah, well, my
and
hope
stuff.
is the state, again, I talked to the state said that I'm going to get more, so hopefully the state will give us what we need. If not, then we got to go rearrange the resources.
And the good news about those is they're just gifted to you by the state, and therefore you are gifting them to these students and families.
Correct. They are federal government to state government to local government to students and families.
And it sounds like you're going to, at some point, maybe start having mobile vans go around again to...
Yeah, I think we need to get the program set in the next 48 hours with the schools. Then when we look at, to your point earlier, the schools are one piece of testing, actually probably the least amount of COVID in the community there. So we go into some of these other areas, surgical testing, and then trying to find the other pockets of it. And then from there, we continue the asymptomatic testing at the FSHED, the rapid industry testing, and we just keep going.
The clusters that you see on the map, if this had been 3 months ago, I expect you might have said many of those were around nursing homes. Is that still the case, or are we seeing neighborhoods?
More neighborhoods now. We've seen over the last 2 weeks some nursing home cases again, which breaks my heart every time I see one. But this is more. This is what I call symptomatic spread in the community, being driven by folks who are sick, going on with their lives, and that's driving most of what we've seen.
The yellow restrictions take effect Wednesday, you said. Is that start the 1 week timeline in which you have to test the schools?
It does.
So Wednesday for the next Wednesday, 25th.
Yeah, and again, if you have a district that can't meet it, then their option the following week is to go remote until they can meet the 20% in a week. So, again, I don't think we're going to see schools just go remote tomorrow or Wednesday. They might go the rest of the week in person if they can't do the testing. I think we can find ways to do the testing. I want to try to find ways to do it. That we'll see what we do.
Would you list the districts one more time?
Yep. The City School District, ESM, Solvay, Lynn Court, Baldwinsville, Liverpool, any of North Syracuse's schools that fall within the 13090 zip code. I think there might be one. Any private school in these areas or charter schools in these areas.
I have an off-topic.
Yeah.
Can I just get your reaction on the county's property tax foreclosure auction? I know it was virtual for the first time, lot was sold, it seemed pretty successful.
Well, we do pretty well with these, and so I haven't gotten our final number on, but certainly we've never done a virtual one, so that was a first. They did other virtual ones in other counties, but we hold towns and villages harmless to tax collection. Properties go years sometimes without paying anything. They get noticed for years. Think of our most famous tax delinquent property, Shoppingtown Mall. They're getting noticed for years. You got to pay your taxes, so nobody can say they didn't know they owed taxes or they didn't have years to set up a payment plan. You have up till that day to set up a payment plan. So I haven't seen the results of it. Hopefully it was successful because that's money that goes back in to pay for the types of things we're talking about.
Yeah, they recouped all of the back tax money and then more.
Penalties and interest and back taxes are essentially what you try to recoup. Again, if you have a property that owes you $100,000 and it gets auctioned for $10,000, you took a loss. But there could be properties that get auctioned higher than what's owed to you as well. So I haven't gotten a report on any of that, though, any specifics on how the dollars and cents that we did.
Would you just update on the situation at SU surrounding coronavirus? No
Yeah.
in-person classes, correct?
Correct. Yeah, so I think it's a situation where you have, during the whole semester, just a tremendous job that the university did, the students did. When there would be a mistake, there would be a party, it's easy to quickly contact trace. And then if everybody at that party, when you're testing, are your positives, you know what happened. I think what you're seeing now is more broad-based spread on the campus, which is going to drive a lot of cases if you don't do some things to mitigate it. So they're putting in proper mitigation, just like what's being done here. And again, in a couple weeks, we're not going to have higher ed cases anymore. Everybody's going to go home after Thanksgiving break, and they'll come back in next year and start their spring semester. So, essentially 8 to 10% of our cases will drop, the type of cases. That doesn't mean our case numbers will drop. Other questions?
The two deaths you mentioned a minute ago, the 78-year-old and the 66-year-old, those were the most recent ones?
Anything else? All right, folks. Thank you. We'll see you later this week.